Hello, everyone, and thanks for joining us today. My name is Pamela Rowan, and I'm the Marketing Director here at SME Superior Medical Equipment. And if this is your first time here with us, welcome. We have a variety of different webinars and workshops and continuing education that's on our calendar. Just visit the events page on our website, that's smeincusa.com, to see what's coming up. We are thrilled to be joined by Ellen and Jerry to lead today's webinar, Elevating Care Through Patient Engagement with Remote Therapeutic Monitoring, or RTM for short. And Dr. Ellen Morello is a physical therapist and digital health executive with over a decade of experiencing bridging clinical care and innovative technology. She currently serves as the U.S. General Manager for EverEx, a global RTM and patient engagement software platform where she leads strategy, operations, and market expansion for the U.S. Ellen was an early team member at multiple high-growth health tech startups, including Physera, which has since been acquired by the Omada Health, Nice Healthcare, and Second Door Health, focusing on scalable virtual care delivery and clinician-centered product design. She sits on the advisory board for several other health tech startups. She's been practicing telehealth PT since 2017 and is an APTA telehealth certificate and digital health certificate instructor. And can you believe that with all of that, she still has the mental bandwidth to serve as the co-chair of the APTA First Network? Very impressive, Ellen. Thank you.
Thanks
And
so
thank you, Jerry Durham, for joining our discussion today as well. Jerry is the founder of the Client Experience Company. He brings over 30 years of experience in physical therapy and more than 20 years in business ownership into the consulting and coaching world. Jerry helps healthcare practices, tech platforms, and service companies transform how they attract, engage, and retain patients with better patient engagement strategies and execution. His mantra when creating systems is always do what's best for the patient because it's best for business. Welcome, Ellen and Jerry.
Thank you so much, Pam. I'll go right into sort of a deck here that we prepared to talk through and go through some RTM things. I'm not going to read through all the learning objectives, but basically we're going to just start with kind of RTM fundamentals and kind of go from there. Jerry, feel free to interject at any point in time with thoughts and commentary because it's always the best. So, just RTM defined, remote therapeutic monitoring is RTM. It is a service that uses technology to remotely collect data. It is non-physiological data. So, what that means is there's another remote physiologic monitoring program that exists where you're collecting things like heart rate or respiratory rate, so more physiologic data. This is non-physiologic data such as like a therapeutic response, self-reported outcomes, adherence to exercise. These types of things would all be non-physiological data points that you can monitor remotely. And there are specific CPT codes. We will do a very brief overview of those because there are some new ones, and that's exciting, which allow healthcare providers to bill for the service. But Jerry, I know what you're going to say, and that is that the billing is the secondary thing, which is wonderful that we now have a way to bill for something we're more or less already doing when we're prescribing home programs to patients. So more or less thinking of RTM as a way to just engage your patients remotely, drive outcomes, and generate some additional revenue. All right. Anything to add, Jerry, or shall I keep on chugging along?
You keep on trucking. You already hit the hot spot for me. So there you go.
I already know what you're going to say. So a lot of times people ask, what is data transmission? It is a kind of a new concept for PTs to think about data transmission. So what is data transmission? And basically, there are all of these little things that can be done that count as data points. It is important to note that this data needs to be transmitted from technically a medical device. So a lot of RTM software companies are technically software as a medical device. So at EverEx, we are a FDA Class 2 software as a medical device, which means our software counts as a medical device that can keep track of all of these data points. So data points that we're tracking on a day-to-day basis are exercise completion, which exercises are completed. We're capturing information about the exercises completed so the patient can report difficulty or issues with the exercises they're completed. We're tracking range of motion measurements. So we've got computer vision range of motion, in-app messages. Those are data points. We have integrated step counters. So step counting might be a data point that's an important component of patient care. And in-app symptom reports. So if the patient's reporting high pain, if the patient's reporting difficulty, all of these things are data points. And each day that the data is transmitted counts as a data transmission day. The other side of RTM services, so is basically, what do you do with all this data? And it's your responsibility as the PT that's assigning the RTM to monitor this data, to say to your patient, hey, I'm going to ask you to do some things at home, and I'm going to check. I'm going to see how you're doing. Please give me feedback. I'll review this data. And the time that you spend reviewing that data is counting towards monitoring time. So this is time you're probably spending anyway, where you are reviewing their home exercise programs, you're making changes, you're collecting feedback about how they're doing. But with RTM software, you're often able to review all that data in one convenient place. So this is a sample of one of our data dashboards at EverEx, where you're day by day, you can see what their symptoms were, what their adherence was, what their step counter was, and all of this data. I do have a little prototype to show later as well, but all that time you spend looking at the data now counts as billable monitoring time. So very quickly, I'm going to just review some of the codes. There are two categories of CPT codes that allow you to bill for RTM services. So the first category is about that data transmission. So this is our software is capturing that data, counting the number of days that the data is transmitting. And there are two very new codes as well. So I'll explain some of the new codes briefly. There's an initial setup code, which is just for getting the patient set up on RTM services. Now there is a lower threshold to the number of days that data is transmitted to be able to bill for the data transmission codes. So you ultimately, at the end of a 30-day cycle, these data transmission codes are billed on a 30-day cycle. At the end of the 30 days, you will look and see how many days did data transmission occur. Ideally, the software is tracking that for you, so you don't have to go through and count days of data transmission. So our software is counting all of those days and letting you know where exactly you're at in your data transmission journey. And then if you've got less than 15 days of data transmission, you would build a 98985 new code. These codes go in effect January 1st. If you've got more than that, then you would build a 98977 code for that 30-day cycle. The second category of codes is on the monitoring time. So the time that you as a clinician are spending reviewing this data, and all of that is tracked. Our software has an automatic timer that's running as soon as you are in the patient chart, counting down the minutes that you are monitoring the patient. You can pause the timer for any reason if you ever have to, but it is running every time you're in the patient's chart monitoring. So now there is a under 10-minute code, or basically first 10-minute code, which is 98979. So this is new. So previously, you had to monitor a patient for at least 20 minutes to be able to bill monitoring time for that calendar month. But now there is a 10-minute code. That's a new code, also coming out January 1st for billing for 10 minutes. Then there is a 20-minute code. The 79 and 80 are an either or. You're either completing 10 minutes in that month, or you're completing 20 minutes. Then anything in addition to that, over the 20 minutes, you could bill multiple 98981 charges within a calendar month. So there are different categories based on either software tracking data transmission or time you spend, and a little different because one is on a 30-day cycle and one is on a calendar month cycle. What a lot of our customers do, and we do have some success tips later on in the webinar too, but a lot of our customers like to find a date in the month that works where they can review like a snapshot of where the patient's at on that, either that 30-day cycle or that calendar month cycle and bill as many charges as they can on that one date. It's a little complicated because the two categories run on different cycles, but there is a way to streamline billing operations, even though they're a little bit different. And again, our software is tracking it all to let you know exactly when codes are ready to bill. So it takes a lot of the guesswork out. Jerry's favorite topic is CPT codes, so I won't spend too much more
time. Did you
time.
go over them yet?
Jerry blacked out.
I think the key is two things, and Ellen's going to show you all this. The dashboard I love. So not all RTM platforms do this. EverEx does. So it's just something you should keep in mind as you're reviewing platforms. How are we going to track all this? By the way, I've seen someone who created a whole Google Sheets setup for this, but that took more time, took more energy, took a dedicated person. So the dashboard to me is very important here because yes, we want to bill for it, but as Ellen said, this can't be the focus. If the focus becomes the billing, you're going to get caught in a little death spiral. So I think EverEx has done an awesome job on bringing that all together to not make that a friction point for you. So I just want to throw that out there and people get to see that. As someone who hates CPT codes and doesn't want to go into them, when I see the dashboard and go, cool, I don't have to get into them. I just have to know, right, when to turn it on, when to turn it off, and what the documentation means. So just a little kind of like real in-clinic experience.
Thank you, Jerry. I think if I can make a little catch line, it's that the codes are complicated. We're making it simple. So what Jerry does really want to talk about, though, is driving adherence, improving patient outcomes, and improving patient satisfaction, and RTM as a tool to do all of those things. Happily, we can bill for it, but that is the focus, is drive that patient adherence, improve patient satisfaction, improve long-term value of lifetime value of a patient by providing better care. And I really do think RTM is a way to do that. You are able to drive outcomes by getting the patient to be more adherent to exercises at home, giving them those reminders and sending those messages. I love talking about this study. This was done by my colleagues at Fizera and Omada, but we looked at essentially a program where you're driving adherence to exercise. And the results were the messaging really does drive patient adherence. Improving patient adherence improves outcomes. Improving outcomes improves patient satisfaction, and they are all beautifully interrelated.
As someone, real quick, sorry, you pause there, and I was trying to find the unmute button. As someone who's not a big, deeper diver into research, this is a great research article. If you're going, okay, RTM, I want to be able to do billing, but how do we look at it with patient engagement? This is an awesome study, and it's so good. I brought Todd Norwood on my podcast to talk about this study, the author here, the second author on the paper, and he breaks it down really well. So if you're thinking about RTM, if you're not sure about the overall value of RTM to your business, and do you want to invest your time, money, and energy with an RTM platform, I would highly encourage you to read this and go listen to my podcast with Todd. Not because I get listeners, I don't even track that, but listen to the conversation with Todd because he really breaks down his experience of doing this work. So I just want to give Todd a shout out there, Ellen, because I think this paper is so valuable to people who are still learning about RTM.
100%. Yes, I couldn't agree more. Todd is hands down one of the smartest people I know. So if you get a chance to listen to Todd speak, please do it. So that's awesome that you can just reference the podcast. In addition to that study, there are other studies out there on RTM. Really, we know that patients go home and they don't remember exactly what you just taught them. It's really nice to have a way for them to simply at home, press play, follow along with a video-based exercise program because it takes the guesswork out of it for the patient. They don't have to remember, oh, how did they say to do this? Or what were the tips? What were the instructions? With a video-based program, the patient can just press play. They get instructions. They get guided through it in just such a way that it helps you as a clinician feel, I know that the patient can follow this because it's so simple for them to just do a video. The app, the EverEx app, we count down reps. We make everything simple. You can give custom instructions just so that you take all that guesswork out for the patient. This also helps drive adherence because we know that patients don't always do their exercises at home. So when you say to the patient, hey, I can actually see if you've done this or not, and I'm going to be looking at it, and I want you to give me that feedback, it really is an incentive for them to go home and do the program at home. And then you can say, by the way, I'm going to ask you about it next time I see you too. And I'm going to discuss your home program with you and would really like to know how it's going. That's just such a strong behavior change technique to get the patient to do exercise at home.
Hey, can I put out one thing on this page, Ellen?
You got it, Jerry.
Yeah, I love what you're sharing there as I'm reading down this. I want people, so again, we're talking about RTM, right? We're talking about, yes, you can bill for it, but I want you to look because the study proves, right? Research proves, it probably doesn't prove, but I like that word because I agree with it. Research I agree with, it's my favorite research. That line there that attended, so when a portion of the physical therapy plus RTM, right? And so it's incorporating the RTM, just like Ellen said. And I love her example. I cannot tell you how powerful that conversation is with someone to go, hey, I'm going to check in with you, right? And they showed here attended more than 2 visits per week compared to controls. So when we call this a patient engagement tool, it means it's helping not only because everybody's going, oh, I can communicate with them when they're out of the clinic and I can bill for it. And I go, but you can not, and you can get them to show up per their plan of care. To me, that's the bigger picture, right? So again, this research is showing you that people show up for their visits. That has to be high on the list of benefits of an RTM platform. And this is across all RTM platforms, right? So right? You want the back end to be easy to use, like Ellen showed you, yet this is the real benefit of the platform as far as I'm concerned.
Yeah, 100%. I think you summarized that very well, Jerry. So yes, you can review this research here too. This was just published this year, a large scale RTM study. Patients do attend more visits. They like having access to their PT outside their clinic. It makes them more engaged, and ultimately a more engaged patient is going to be participating both in person and at home. There was a question in the chat. Jerry, did you want to cue that up now or should we do that later? Oh, you're on mute. Still on mute.
Thank you. There's a question in the Q&A, and I believe there's going to be a demo for this, but let me read the question. In addition to in-app messaging from PT to nudge clients, right? We all know that word nudge, right? And that's what RTM helps to do. What other features in the platform keep patients engaged? Should we wait till the demo to answer that, you think, Ellen? Because there's a lot, I think.
Yeah, that's a good question. I'm going to say we will get into the messaging. This whole section right here, I think driving adherence ultimately does come down to messaging. I think the stronger the messaging, the stronger the patient-provider relationship, the stronger the adherence. So I'll demo some of our messaging components. There's other things like in-app notifications, in the application itself, trying to keep the patient engaged with like features that make it more sticky and patient education, sending custom videos, those types of things where there's a lot of content available to keep the patients engaged. But push notifications, we've got an easy SMS sign up flow. So it's easy for patients to sign up. So there's some things like that we're doing from a tech perspective. But yes, I will show some of the messaging component.
What else? I think about what the drive engagement, right? And nudge, that question asked. So when I first met EverEx, I got in there as the user. I met Ellen. She goes, I'll sign you up. I said, cool. And I got into it. And what it does, it asks me to answer 3 very simple questions. It's so simple, but yet that in itself is a nudge, because if you say you're having difficulty with your exercises, boom, you're going to respond. If you say your pain increased after an exercise, boom, you're engaged. So Ellen said all these nice things that it'll do, yet I think I don't know, this is my bias, right? If we can keep it down to what's important to that person, their goals, their exercises, their pain, right? It asks about pain and it asks about your ability to do the exercises. The messaging, I believe, is number 1. And there's great research to show just messaging drove compliance through the roof. So just messaging. And then if you get people to engage with those 3 questions, it gives you a reason to respond back. And by the way, it's your response that drives future engagement, not their part. I'm just going to say this, right? If you sit around, you didn't ask this question, but I want to go this route. People are like, wow, no one's messaging me. I'm like, did you message them?
It's
No.
proactive messaging, right?
Yeah, it's proactive. You've got to lead off the front. And the research shows that also. You
Yes.
got to lead. Hey, Ellen, how are you? Hey,
Mhm.
Ellen, how was your exercise? And this is auto. How are your exercises? How are your pain? So again, if you guys set it up and you lead the messaging, then engagement goes up, compliance goes up. So I know that's a broader answer, but that's really important when we're thinking about nudging people to do things. It's on us. It's on us. It's on us.
Absolutely. All right, let me go back. So I'm going to give just a super high level overview of one of our customers and some of the success that they saw as the small practice, single location practice. During a pilot period, they enrolled 77 patients. Each patient was logging into the app on average like almost 60 times. That's pretty good. And then over the course of the pilot period, they logged like over 1,500 workouts, which is amazing. So average 20 per patient. If we could really make sure patients are doing exercises 20 times at home, that's going to have a very meaningful impact on their clinical outcome. A number of messages going back and forth, more messages sent than received. I think that also speaks to proactive messaging. On average, about 20 minutes of monitoring time per patient. And then there was an average pain reduction and an average range of motion increase. And a total reimbursement just during this little like pilot period, they saw almost $15,000 in reimbursement. Just want to give a little snapshot of some of the success a clinic of ours has seen. Any questions here before I go into some patient examples too? Just a patient kind of case study. This was like a fully virtual episode of care, but more or less you could imagine that this was the virtual follow-ups were in-person follow-ups too, where this was a patient that was experiencing hip pain, started PT and got enrolled in RTM right away, had a handful of visits and billed RTM and achieved a very successful outcome. I'm going to also just disclose that this patient was my dad, and he had a very sedentary lifestyle for most of his life. And using RTM, he like actually started incorporating exercise into his daily routines. He does his stretches like throughout the day. He started walking, he started biking. I'm like, who is this person? And I really do think it was like that his PT was holding him so accountable and actually watching him do his exercises at home and giving him very appropriate exercises. And so I just saw tremendous change with his progress through just doing virtual PT and RTM. All right. So now this, I do want to shift over to do just like a quick little product demo of the dashboard and how we've got some really exciting things going on with the messaging and ways to keep patients engaged. Just a little summary here. So we've got a couple of snapshots over there. We've got an AI range of motion assessment. We can do 27 different joint ranges of motion. A very simple app for the patients to just complete their exercises, follow along, fill out their symptom report, message, all of those functions, like PT in their pocket in many ways, and they kind of having that access to their PT. We will get into sort of some of the CPT tracking, because again, that is a complicated thing that we're making simple with our software for tracking and billing, monitoring all of the clinical outcomes we've been talking about. The patients can easily download the app through a text message. You text them a link to download the app, makes it easy for them. Then I will also say that we've got like an embedded EMR tool that we can use for cloud-based EMRs to simplify the workflow for PTs. And that really helps on the PT side of the workflow. Our dashboards keep track of everything, and I'll review that now. But yeah, automated reminders, notifications, those types of things to keep the patients adherent. And then we've got a great customer support team that's available to help every step of the way. So I'm just going to switch over to my other tab for a second and pull up our like a little sort of demo environment here for you to see some of our dashboard. Okay. All right, we have, this is just one of our dashboards here, but it is a very simple way to get a snapshot of basically what's going on with each patient. For the codes, we're adding the new codes. They will be released January 1st, so those ones will also be tracked. But it will be very easy for you to get a snapshot of where the patient's at in their journey of RTM. So it will tell you, okay, for 7.7 code, 13 out of the 16 days of data transmission have occurred. Where you're at in terms of monitoring time. So if there's what is required to satisfy these codes. So you'll see for Sarah Anderson, there's a communication required. 880 requires asynchronous communication. And then you've completed 19 out of the 20 minutes of monitoring. So it's pretty simple to know where patients are at in their journey. We also have this great way to simply snapshot your whole caseload and know what needs to be done from a messaging perspective to keep patients engaged via messaging. So if I were to click, okay, this patient, Eric Taylor, has been inactive and I want to send him a message, it will basically just draft up a message for me by clicking that simple button. And it says, I noticed you haven't logged in a few days. I know things get busy. Just want to see if you have any questions. Gives the patient that nudge. Hey, I noticed that you're not doing your exercises, in a very friendly way. And then the timer will start running once you're in that patient's chart and sending those messages. So I really like this feature just to get your caseload, see like a clear understanding of where everyone's at and a clear action that you can take to send a message based on a number of factors, right? There's messages for symptom increase or if they reported difficulty with exercise. What we're building from this type of framework is actually going to be really exciting. There is a lot that can be done with messaging now, and I think we've got an amazing AI team that is working on some very innovative stuff to make messaging as easy as possible. Ultimately, still the clinician is in control, but there are a lot of tools to help make this messaging component as easy as possible for the PTs and as clinically meaningful as possible. So I'm just going to go back to this tab too, because this is an example of just like a data dashboard where you can click on a data point on a day and see what's happening with that patient on that day. And you would see, okay, on this date, the patient did all of their exercises. They reported this one difficulty with this exercise. You can go through and review range of motion over time in a just really simple way to see exactly what's going on with all of your patients' data. I am going to stop share and then pause there for questions at all. But really robust ways to keep that messaging going. Know, all right, here's a good message that would resonate with a patient in this type of situation and keep it as simple as possible for the PTs.
I think part of what you all do at EverEx, and back to this point of the messaging, Ellen, is right, this idea, if you have the person onboarded before they arrive, so they're ready to go on the app, right? You, the provider. So clinic owners and providers here on this webinar are listening to this, think about this, right? We don't, a physical therapist, by the way, I'm right. I dropped my initials off of that first page, but I am a physical therapist. I just haven't treated people, but I still listen to evals. I still listen to new patient calls. So you get someone onboarded before they arrive. Then the provider in the room just has to introduce the person to the app. Also, if you just went through a half hour, 45 minutes, 60-minute eval with the patient, right, and you took them through the structure and you gave them the plan of care, now is a great time to prime them, right? We can call it pre-suade. There's a great book called Pre-suasion, right? We can start to prime them for what's coming next and asking, I might ask Ellen, so Ellen, I'm going to, right, be messaging you.
Yep.
And maybe I learned a little bit more about you and I say, hey, Ellen, so I'm going to be messaging you then probably at 10 a.m. every because you heard something, you had a discussion. Maybe you hear Ellen's there, she's postpartum. And you know that she told you, man, until 10 o'clock every morning, it's just chaos. And you mentioned, so Ellen, I won't be messaging you before 10 o'clock. That right there, when I talk about patient engagement strategy, that right there says you care, you understand, and then you document do not, then Ellen is going to participate. Ellen leaves there knowing, wow, they really get me, right? And then you set up this path to success. I'm going to tell you, the onboarding team at EverEx gets this stuff and they share a lot of this. And these are the things that if you come on and you go, oh, we're going to do a pilot study or, oh, we'll commit to 90 days. These are the things that need to happen at the beginning because otherwise you're going to go, this didn't work. And it's going to go, right? What did you do? So this patient engagement side that I like to bring to the conversation, you have this awesome platform. Now, how are we going to make sure it's successful? We have to do the work. And you heard that at the beginning. The research shows it. We have to do the work. And the work is as simple as going, Ellen, I heard you. You won't get any messages from me before 10 o'clock. By the way, even if you would never message someone before 10 o'clock, you say, Ellen, oh, I promise I won't message you before 10 o'clock. That's the point, right? So I just want to talk about that. And that is the value. And again, I love you guys saw it on that screen she showed. I didn't want to chime in there, but it said about like pain, exercises expired. How cool would it be if you reached out to Ellen and go, Ellen, I know your exercise is expired. And they're like, wow, they are really keeping track of me and want me to get better. So again, these are all the strategies that are easy too easy. Simple, never easy. It's not easy. It's simple. But then we got to do it, right? That's the hard part. So these are the things as Ellen giving you all these great cues and showing you their great dashboards and the systems. And then you saw those exercises. I've got to sit in on some onboarding. If someone sees a lot of ACLs and they have specific programs, you can create your ACL program. So Dr. Ellen PT, who treats all these ACLs, right? And then her ACL patients come in and she knows how to talk to them and she knows that this is just going to blow the relationship out of the water in a very good way.
Yes. And we're doing a lot, both from the preset program side, custom programs, but just, yeah, we're building a lot on the back end to make sure things are as simple as possible for the PTs in terms of auto progression. What are the next best exercises? So you don't have to think about that. What are the messages that can be more automated versus the ones that really need your response and review? So there's a lot that's being built that's really exciting from that perspective. But then, as you said, Jerry, on the spiel that you got to give to the patient, right, and get their buy-in, it is such a negotiation sometimes, right?
It really is. Yeah, it really is. Yeah.
And so if I were setting a patient up on RTM, I would often say, what length of time is going to work for you? Do you want a 5-minute program? Do you want a 15-minute program? Do you want a 30-minute program? What is going to be actually doable for you? And at what time is best for you? And you can set the notifications to go at that time. That's best. The patient can set those too. And then it's making a program. We do recommend starting with a small program. I think that is a principle of behavior change too, of giving the patient something more bite-sized to start, just to get them into the routine of going to the app and using the app to get started on a program. And then you can build on it from there. But it's a good way so that they don't get overwhelmed by a 30-minute program that they have to do at home. And so that's just one success tip that we've got in terms of, I'll go back to my deck over here. There it is. Okay. But yes, another success tip is keeping it simple.
Oh, excellent. This is a great slide, by the way. Yeah.
Thank you, Jerry. But yeah, setting those expectations, what they should do, keeping it simple. And then, yeah, changing it up periodically. Patients may feel it gets a little stale after a couple of weeks. They want to be progressed. They want to move things along. And sometimes patients, maybe at the end, they're like, no, I'm on a good routine. And they may want a stable routine at that point. But if they're early in their care, they should be getting progressed along in their care. It is also helpful to set up, if it's a synchronous interaction, you can set those up in advance to satisfy that synchronous requirement. That could be done in person. If you're seeing the patient in person, you can have those conversations live. But if it is fully remote, you want to set up that time to have a synchronous interaction. Giving them encouragement if they complete their workouts, it's rewarding them for completing it. And then just on the billing side, there's a lot that our success team has to share about ways to make billing successful. And we go into detail about all of those during our client implementations. But there are ways, and it depends on your EMR and your systems and your processes. Sometimes there's ways to make it easy depending on all types of situations.
That set expectations early tab is my favorite, of course, right? The research says managing and setting expectations are the key to outcomes, right? And it's unequivocal, and it's always been that way. I'm going to one up this and say set clear expectations earlier in their journey. Again, I alluded to this already, and EverEx is so tired of hearing me say this that they have to roll their eyes when I say this. Otherwise, I don't feel like anybody's listening. But getting your front desk engaged in this. And if Ellen is on the phone with me scheduling her first ever physical therapy appointment, I'm going to tell her that part of her process here at ABC Physiotherapy is we have done something that we have found to be very successful with our clients is we have a communication app here. We have a communication tool here at ABC Physiotherapy, Ellen, that's going to allow you to stay in touch with your physical therapist. And the reason I pitch it that way, if you read the research, one of the top asks patients in America say is they want to be able to communicate. So again, the structure of how we do this and how we say this is based on the research of what patients and consumers want. So I tell Ellen, it's going to allow you to be able to communicate. And that's all I have to do early, right? So if I say that and the provider in the room says, oh, by the way, Jerry, here we go. Here's our communication app, right? That snowball just keeps building. So I want you to think about what can you do throughout their journey, just like Ellen and I said, the way we pitch it or we ask. Ellen actually said, if you don't hear an expectation, you got to set. So if I'm going to set an expectation, so Ellen, how much would you like? 5 minutes? Ellen already took you through this. So if I don't hear the expectation, I got to ask. And by the way, asking says it's about you, not me. If I tell you, it's about me. So just some tricks. I don't want to call them tricks, some steps in creating and managing and setting expectations that will set you, the provider, you, the business, up for success that will lead to patient success.
Absolutely, Jerry. I won't roll my eyes when you say it.
This is such a great anymore. This is such a great sheet, though. This really is. It's each of these, you could go into 30 minutes on this. And this really is a success sheet right here. I love it.
Yeah, and our success team put this together. I think that they're a real strength of ours, that they work so closely with our customers, making sure they know how to make everything successful and feel really good about their whole program. That was the end of like my content. I know there were maybe some more additional questions, and I wanted to leave some time for Q&A.
There was a question about codes, and so I'm not even going to ask it. No, it was about the
new codes.
And I think the new code thing you shared, Ellen, I'm just going to say this, is allows you to do, there you go. There you go. Why don't you address that real quick?
Thanks. Yeah, so I put new next to the two new ones. It's interesting. So my mental model was like, what would be satisfied first to what would be satisfied later in the journey, the two new codes. So on the setup and data transmission side, the new code is the 98985, which allows you to bill for 15 or less days of data transmission, between 2 and 15 days. So typically in order of, you'd get the patient set up, get them able to satisfy the 7.5 charge, and then you would bill either the 8.5 or the 7.7 charge, depending on how many days of data transmission. So the 8.5 would be an easier kind of barrier to meet that data transmission requirement. On the monitoring side, though, the new code is actually for less than 10 minutes of monitoring. So it comes before the 8.0 charge would be satisfied. So again, it's an either or code. You would either bill the 98979 code if you've got 10 minutes of monitoring time in the calendar month, or you would bill the 8.0 charge if you've got 20 minutes of monitoring time in that calendar month. And then the 8.1 is in addition to. So if you spend more than basically 40 minutes, you'd be able to bill an 8.0 and an 8.1 for that calendar month, if that makes sense.
Being you brought up billing, I'm going to put in my post-amble again. EverEx has a great dashboard. Do you have a picture of that page, Ellen? Or is there a demo in the of the
Uh,
dashboard page?
the RTM tab,
Yeah,
I could just have to switch.
because Ellen alluded to, when you set the timer, if you set the timer right, it will tell you, it'll go from red to green to tell you
Mhm.
when a lot of these are met. So you don't have to track these manually. So as my eyes glaze over, God bless Ellen, I love her. As my eyes glaze over, as anybody talk, I can't sit through God, I love Rick Window, but I can't sit through more than 15 minutes. That's the beauty of this is yes, you want to know what coach you're billing in, basically the high level, but this dashboard will help you. Yeah, you can see ready to bill, not started.
Yep.
Call me simple. That's all I need to see as a provider.
And exactly, and we'll tell you what's required, right? Is what requirements are met. This is 19 out of 20 minutes. All right, we got to do one more minute. One communication is required, then it will change to ready to bill. And this is just one sample. We have like other RTM dashboards too, where you can go through code by code. There's a lot of different ways to parse through.
This is a great first glance. If I'm coming in the clinic today, right, and I turn my computer on and I get on EverEx, I'm going to scan down and just see, hey, what's going on with my recent people? Where am I? It becomes almost at a glance. And then I don't need to touch every one. I just see, oh, okay, I need one more minute. Oh, geez, do I have Mrs. Jones on for this week? Oh, yeah, cool. I'll create, right? One of our most valuable tools is our beginning and end of day checklist. This would be my probably end of day checklist because I'd want to leave knowing what I need to do the next day, would be looking at that tab. Just to bring it back to how that works in the workflow, because when you guys hear it more than I do, constantly get people that are in the weeds so far, they can't visualize or think about the workflow of how you incorporate RTM. I'm going to say RTM into your daily life. And that's how you have to be thinking about it. Because if you're looking, I've been on calls and heard people, oh my God, this is something new. I'm like, no, it's not.
Yep.
It's not new. It's, you just have to look at a new way of doing what you're already doing. That's all.
Yep. I think even it just along those lines too, just one simple thing like the embedded EMR plugin we have too, it also helps like if there are ready to bill charges and you're in a patient's chart in the EMR, it will say, hey, there's charges ready to bill. So you don't even have to like toggle back and forth as much. There's a lot that we're doing to keep it simple for the optimized for where you're doing your workflow. And that might be in your EMR.
There's a question in the Q&A. I think I know a guy who wants to address that question. Jerry, can you speak to how you handle this? Is good. And let's get the right. It's the 900-pound gorilla, right? I am the 900-pound gorilla, but it's the 900-pound gorilla in the room that no one ever wants to bring up. And then they wait too long. And by the way, 3 months later after the pilot, it's, oh, none of our patients want to pay for it. It was like, wait a minute, what have you been doing? Jerry, can you speak to how you handle the conversation with the patient regarding patient responsibility for RTM before they get started, as many private payers do not cover RTM? Awesome question. And by the way, I'm going to answer this by saying I would handle the conversation the same with everybody. 95% of the conversation the same with everybody, whether insurance covers it or not. If we know specifically it's not going to be covered, then yeah, we can, because I am not, as a practice owner, as a business owner, I'm not someone who's going to go, we're only going to sign up people who we get paid for. Everybody's going to have, do not sell short the opportunity to let people get on the platform. Do not sell yourself short on offering the value of RTM to someone. So here's the beginning of the answer to that question. If you sell RTM as a value, as an asset, as a value add to their experience at the company, you're going to be surprised how many people will say yes when their insurance doesn't cover it. So the conversation has to be, and you guys heard it earlier. Hey, Ellen, right? Ellen's never been to physical therapy. And by the way, Ellen said she wanted to use an insurance that we know won't cover it. Let's just go there. Let's just go there. I'm like, cool. And part of me is cool. I always say, cool, thank you for telling me what I need to speak to, right? I don't say that part out loud. But the conversation I'm going to have with Ellen, I'm going to sell the RTM in the same exact manner. The communication with your provider. Who else gives you, hey, Ellen, something we do here at ABC Physio that we don't know any of our competitors do is we give you, just bear with me on this terminology, 24/7 access to your provider. We have a communication app here that we use at ABC Physio where you're going to have your exercises and you're going to be able to communicate directly with your provider. And we are committed, right, to your journey back to getting to the gym pain free and out of that morning pain. Right then and there, I'm just done selling it. By the way, I'm not going to say the name of the person because he typed it in the Q&A, but to the person who asked that question, that's the sell. What is the value to Ellen? Don't talk about the value to the business. Everything I just said is of value to Ellen. She gets to decide if she wants to pay for it. Now, if you guys are giving benefits on the first phone call, now's the time to have the discussion. I typically work in systems, and my system was I did a call once I got all their insurance benefits and verified if it was going to be covered or not. I did a cost callback. So it'd be during the cost callback that I would then have the discussion. And by the way, this will be your copay. This will be your cost. This will be your coinsurance. And Ellen, the communication app I talked about, many insurances do cover it. And don't, never say unfortunately, never say anything like that, my friends. Most insurances cover it, yours does not. So let me tell you what the cost to you will be. Let her make a choice. She's making a choice about the cost for the in-person, and now she's going to make a choice regarding does she want to communicate and how valuable is that to her. So I hope that I'm going to stop there. Obviously, there's nuance here, but that's the kicker. I'm selling the same value. It's just how am I going to then present the price? Am I going to do it there? If I get people's benefits online, I'm then going to have that conversation there. Or I'm going to tell her when I do the cost, but without the value of why she should pay for it, nobody will pay for it. So everybody goes, nobody will pay for it. I'm like, you give them nothing to value. And now I get excited. I hope that answers your question. You know, that's the way to do it. It's got to be what's important. And by the way, the research says what's important. That's the conversation is about what the research says. Direct communication with your provider. I'd throw in there 24/7. No, you're not going to respond 24/7, but they could message you 24/7, right? So we got to start that conversation early. And I just told her how we're different. And I told her how we're going to be better for her. I told her how patients are successful here. I'm managing and setting expectations. I will guarantee you greater success with RTM with that approach. I'll guarantee it.
100%.
You can all hold me to it.
It just like a tangible, my brother just had a slap tear and a rotator cuff tear.
My shoulder hurts already and now it hurts more.
And he couldn't get an appointment for several weeks, but then I pulled all the strings I've got to get him in, but then he couldn't get a follow-up for another 2 weeks. And if he had RTM, he could have been doing exercises every day, making and he would have paid for that for sure, just to have that ability to progress, like without having, while he was waiting to be seen, because he's someone that like wants to keep doing the next hardest thing, progress through, but instead he was in this like waiting period for his next appointment to progress his exercises. And he totally would have paid for that access.
Don't get me going on this because there's huge value. That's all I'm going to say.
Access is
huge value, huge value. What a great way. By the way, you have a wait list. Now you got a solution. We could do a whole nother webinar on how an RTM platform can manage your capacity. It can grow your capacity. Ellen's had to sit through me raging on about this, right? It grows your capacity. Now, in your front desk, God, we put the front desk in the worst position. Tell people, get them scheduled out. We don't have anything for 2 weeks. Get them on the schedule and make them show up. I'm like, oh, wow. How about if your front desk got to go, hey, Ellen, I got a great solution for you.
Yeah, absolutely.
And by the way, let them choose, right? They get to choose. Remember, the whole strategy here is I check all the boxes and then go, hey, Ellen, what do you want to do?
Yeah, exactly. Let the
And
patient
to get her the price. I like that James asked that because part of the checkbox is the price. So I'm glad you asked that, James. And I can't type, did I answer your question? But hopefully I answered your question. Yeah, so there's so much value here to an RTM platform. And by the way, and you can bill for it. And by the way, you'd be surprised how many people pay for it. And don't tell me people won't pay for it. And please, I'm going to say it out loud. Don't tell me older people don't want to get on it. Read the research. Give them a reason to get on it.
I know there were 2 other questions we got in advance. Maybe is this
Oh, yeah.
Those, Pam?
Yes. Someone asked, how long does it usually take before a clinic feels the impact of RTM, whether it be in patient outcomes or revenue?
This is, yeah, that's an excellent question. So I'll talk on the revenue side because the codes are on calendar month and monthly billing cycles. So typically you start enrolling patients and then you're starting to send out charges about a month later. And then it depends on how long the reimbursements take to come back. So I would say, from getting started to reimbursement, it could be a whole 6-week cycle or so just to truly start seeing the reimbursements come in. But on the patient outcome side, you can see outcomes almost immediately with getting patients started on home programs. And a simple example, right? Like if you have a low back pain patient and you're getting them on repeated flexion extension exercises and they're managing their symptoms and their symptoms are improving, that could happen day of enrollment. I think it depends on the patient, but I think the patient outcomes, you can see those tangibly occur pretty quickly. And obviously we're thinking of long-term outcomes too. So thinking about like some of the baseline metrics, enrolling a patient, getting their pain and symptom scores up front, and then comparing it towards end of episode, you can see things more holistically, but patients can experience outcomes almost immediately. So.
Thank you. The other question, we've got just a little bit of time left. So one last question, if you have quick thoughts. This one person wrote in, I feel this in my bones too. My team is incredible, but I'll admit they are a little old school. So they are hesitant about adding technology. What's the best way to get my staff on board with RTM?
That's a great one. One thing I will say is what we like to do at the start of the kind of our implementations too is we enroll PTs as patients so they can see the patient experience and see how simple it is for the patient to follow along, how easy it is for them to download an app, how engaging it is for them to experience things from the patient's perspective. And then once they see that, then they're like, oh, my patients will benefit from this. It's actually quite simple. And those things can really help just get the PTs bought in. There's so much more we could talk about from like a change management perspective, but I do think ultimately the staff care about getting their patients better. So you can demonstrate how easy it is for patients and how much value it will drive. And I think that's powerful.
Can I add one? I just want to add one sentence. I swear to God. There's the impact, the leadership, the engagement flows from top down. So if you have the mindset that it's what needs to get done and you do the change management and you hold people accountable, it will happen. Yet what I love the fact is I assume a leader, an owner, or a clinic manager wrote that. So you do have the power, right? Because if you're not bought in, because I've heard client calls where I'm not quite sure, I'll let my team decide. I'm like, gonna lose. Don't even do it. Don't bother. Sorry, but the inspiration, the impact, the impetus, the accountability, the big word, has to come from up above. Who's ever in charge? And it doesn't mean you don't listen. It doesn't mean you force things, but you got to be a change manager. So I think it's great that someone says, look, this is important to me. That's step number one.
Yeah, absolutely, Jerry.
Okay. Thank you, Ellen and Jerry, both so much for being here. You guys are incredible, and we're just so grateful for your time and expertise today. As I mentioned in the chat, if anyone wants to try a month of the EverEx RTM for free, please shoot me an email. It's pam@smeincusa.com. And this concludes today's webinar. So thank you all so much again for your time today. Appreciate it.
Thank you so much, Pam. Thanks, Jerry.
Thanks, guys. Have a great day.
Thank you, Ellen.